are just over 10 days away from the inauguration of President-elect Donald Trump.
Some reproductive health care organizations here in Maine say they are preparing for possible changes in federal funding that could impact their services. News Center Maine's Brianna Bush has more.
Healthcare providers like Maine Family Planning, which offers reproductive services and gender-affirming care, are concerned about potential changes to Title X funding.
The fact that federal money is unstable in this is likely to be very unstable in this administration.
Title X is a federal program that provides funding for family planning and reproductive health care to individuals. Maine Family Planning President and CEO George Hill says that could be at risk as President-elect Trump prepares for a second term.
We expect that they are going to re-implement the gag rule on the Title X program.
In President Trump's first term, he implemented a gag rule, which prohibited organizations receiving that funding from providing information and referrals for abortion. That prompted Maine Family Planning to pull out of the program, and leaders have concerns they could face the same thing.
The gag rule would essentially prevent us from providing referrals to pregnant patients for abortion care, even when those patients ask for that referral.
Maine Family Planning also provides STI testing, cervical cancer screenings, and birth control.
We make services available that help people to control their reproductive lives. If they don't have control over their own fertility, then they don't have control over a lot of their lives.
Planned Parenthood also pulled out of the program during President Trump's first term.
And that meant that we lost important federal dollars that helped pay for the costs that we absorb when we provide free care to people.
Planned Parenthood Northern New England serves around 13,000 patients across Maine. President and CEO Nicole Clegg says that patients are also concerned.
They're worried that access to care that they rely on might go away.
But for those in support of anti-abortion policies like Maine Right to Life, the focus is education.
I think education, science allows us to get in front of it, and I don't know what that means because we're just kind of talking about it, but I think that would be the ideal, is to get in front, to be prepared for, whatever comes when a woman, comes forward and says, I need support.
So we're answering those questions every day from our patients. What is my future going to look like?
As the upcoming administration prepares to take office, it's unclear which policy changes will be made. In Bangor, Brianna Bush, News Center, Maine.